Namaskar. This is Siddhartha Singh. I am associated with School of Agro-Rural Technology, IIT Guwahati. For last 14 years, I am teaching in university level and working with different stakeholders, including young population who comes as a student research scholar to us. Um, there is a certain area which we wanted to highlight today. If you look at the metabolic disease scenario in India, it's becoming a very alarming situation. India has ranked, number one in terms of metabolic disease in the entire Asia Pacific region, and about 60% of the population is facing some kind of metabolic syndrome. Particularly, if we look at juvenile health, even in the children under 12 years of age, there is a rising cases of several metabolic disorders, including juvenile diabetes. And by some estimate, it is about 1.5 crore, cases of metabolic syndrome in India. So these are juvenile metabolic syndrome we are talking about. So if you look at, in terms of total number of people who are affected by some kind of metabolic disease, that can be anything between 10 to 15 crores of the population. So if you look at from the disease burden and national productivity perspective, not only the adult population but also the young Indians who are going to be the future of the country, they are suffering from some metabolic disease or the other. And on the other side, if you look at the mental health scenario of India, that is also not very encouraging. So if we look at from the perspective of mental health of youth, there was a recent survey which says out of 84 countries, India ranked 60 in the youth mental health status. So which is again indicating a silent disease burden which is probably crippling the growth of the country, because it is utmost important that the health, both physical as well as mental health of the population should be in an appropriate state, so that the country can progress and country can really become a superpower. Now, many of these disease burden can be tackled to a great extent by use of yoga. So yoga can be both part of the lifestyle as a preventive healthcare system, and it can also be very important. It can play a very significant role in many of the metabolic diseases to at least work as an adjunct therapy. So along with other therapies, yoga has a capability to accelerate the cure of many of these metabolic diseases. There is another area where yoga needs to be adapted, because if you look at the disease burden, especially the metabolic disease burden, about 25% of the entire metabolic disease patients are actually getting some kind of health care. The rest of the 75%, either they are not having access to the health care or they cannot afford the healthcare system currently. And this is across cities and villages of our country. Now this is where again yoga, which doesn't require great cost, and the therapy can be really affordable and accessible to many, can change this disparity of healthcare, especially for metabolic diseases. So if we look at from the preparedness of the population, preventive healthcare system in the entire population, so yoga can be a fantastic tool for inclusive healthcare. So that's why probably the goals of initiative that has been taken by great institutions and supported by government of India is so much.
21 जून अंतर्राष्ट्रीय योग दिवस।